Hello, and welcome to The Learning Post, a podcast dedicated to sharing insights from the UK Aid Match and UK Aid Direct funds. My name is Noeleen Advani, and I am the Learning, Monitoring and Evaluation Specialist for UK Aid Match and UK Aid Direct, and your host for this episode. This episode focuses on UK Aid Match grant holder Sightsavers and its Right to Health project, which worked to bring inclusive eye health to marginalised communities in Pakistan and Bangladesh. I'm speaking to Itfaq Khaliq Khan, Senior Program Manager at Sightsavers Pakistan. We discussed the successes of the project and the steps that were put in place to ensure that the project was inclusive and accessible. Thanks for joining us today, Itfaq. To start, can you tell us a bit about the Right to Health project and its aims?
Yeah, sure. Thank you very much, Noeleen, for the introduction and providing us with an opportunity to share some really exciting updates from the Right to Health project that we implemented in Pakistan and Bangladesh. So let me set a context first. So both Pakistan and Bangladesh are huge countries in terms of population, I should say, have a collective population of around 400 million, and majority of them are living in the rural areas. These rural and peri-urban communities in both countries face considerable challenges in accessing eye health care that include poverty and accessibility. Then we have some subgroups, for example, women, we have people with disabilities, transgender, and elderly. And these subgroups face some additional challenges, such as social restrictions, stigma, discrimination based on their age, their gender, their disability and sexual orientation. So to address these challenges, the Right to Health project was aiming at improving the quality of, I should say, and access to eye care services in project districts for people with and without disabilities and other marginalized groups. And how we aim to accomplish this, it was through provision of screening and treatment for the refractive errors, for cataract surgeries and other eye conditions, maybe surgical or non-surgical conditions. We through working with the partner hospitals to make them more kind of accessible and welcoming for people with disabilities, through organizing the outreach screening camps for them to identify them, and then for the increase of uptake of services. And finally, through a successful advocacy with the government, with policymakers in both countries to have a sustainable change in the future. I should say that this particular project was quite different from the traditional health service delivery projects of Sightsavers, because it was not only improving the service delivery, but also was focusing on addressing the challenge of inclusion and discrimination, social inclusion of the people with disabilities and other marginalized groups in communities.
Great, thanks so much, Itfaq. So tell us a bit more about what steps were put in place to ensure that the project was inclusive and accessible to marginalized groups in Pakistan.
So to ensure that the project activities are accessible and inclusive for people with disabilities and other marginalized groups, the project has actually adopted a comprehensive approach on both demand as well as on supply side. For example, we conducted disability access audits of the health facilities where we were working. We made infrastructural adaptations, we trained human resources, we filled the gaps of human resources and technology. Then we mapped out the marginalized groups, particularly people with disabilities and the organization of people with disabilities. We conducted targeted outreach to identify these people from these groups with eye conditions and then refer them to the uptake of services to the partner health facilities. But the most exciting step, I should say, to me, was the collection of disability disaggregated data, because this is an area which is, I should say, a global challenge. The availability of reliable data on disabilities, it has been a global challenge and is not different in Pakistan. So we used Washington Group short set of questions for the collection of disability disaggregated data, which is a tool which is widely used globally for the disability data collection. And the analysis of the data collection tells us that around one half of the patients reaching the health facilities in Pakistan were the people who are the people with functional limitations. So this is the most important part to me. And just for the interest of those who want to know more, telling each and everything around disability data disaggregation is not possible here, but we do have in detailed analysis and reports available on the with Sightsavers for the reference.
Great. That's really, really fascinating. And the Washington Group questions, especially, are a real challenge and something that people obviously want to know more about and how to collect that disaggregated data. So you've already mentioned some of this, but what have been some of the key successes of the project in Pakistan?
Well, so as a result of the steps taken that I've just mentioned to improve the inclusion and accessibility, the project has greatly contributed in terms of improved service delivery for the most marginalized, as well as making some strategic level achievements. So, for example, in Pakistan alone, I'll talk more about Pakistan because this is where I belongs and know the context better. So, for example, we reached around 1.5 million people with eye examinations during the project life. We supported around 38,000 cataract surgeries while providing 500,000 refractive error examinations by qualified optometrists and 500,000 non-surgical treatments. But then through our program work, we could also influence some of the policy changes, I should say. For example, we supported the formation of an inclusive eye health task force under the umbrella of National Committee for Eye Health, which is working under Federal Ministry of Health. And the purpose of having the inclusive eye health task force was to take lead on inclusion work in the eye care sector. We also supported development of national and provincial integrated people-centered eye care plans for 10 years from 2021 to 2030, which are completely aligned with the WHO's integrated and people-centered approaches. And this will really be helpful in changing the eye health landscape in coming years. In addition, we developed a sign language module for eye health professionals. It was a customized module to help them, to equip them with the skills so that they can take care of the of people with hearing impairment whenever they visit the health facility. And finally, we supported making national SDGs monitoring dashboard under the Ministry of Planning, Development and Special Initiative, make it disability inclusive through creating disability disaggregation against 67 indicators pertaining to disability, and that also includes SDG 3, which is around health and particularly around universal health coverage.
Fantastic. Really, really amazing successes. And I guess you've covered this a bit already, but how sustainable are the changes that were achieved? And have you seen improvements in the health system infrastructure or policymaking space in Pakistan?
Yes, Sightsavers as an organization believes in strengthening of existing health systems and infrastructures instead of creating parallel systems. So the Right to Health project has revitalized the existing systems instead of creating the parallel one and making them inclusive for everyone, including marginalized groups. Most of the investments made through this project will sustain post-project as these are well embedded into the systems. For example, we were very vigilant that the human resources trained under the project are the permanent staff of the partner organizations and not the project-based staff. Because if they are permanent staff, they will remain there within the organization to serve within the sector for quite some time. Also, infrastructural changes that we made at the hospitals are well institutionalized, and the partner has made commitments to replicate them to the other hospitals as well. For example, they are constructing 2 new hospitals, and the changes that are needed within the infrastructure, they have brought them in right at the beginning. So this is how the changes are institutionalized. Then the Inclusive Eye Health Task Force that we developed under the National Committee of Eye Health is a part of health systems, as a part of the Federal Ministry of Health, and will remain there to provide leadership or oversight to the inclusion work within the eye health sector. So that is also one thing that I should say that will remain quite sustainable even post project. And the sign language module that I mentioned is developed under the project, but that is integrated into the inclusive eye health curriculum at one of the public sector university within the curriculum of optometry. So that will also remain there as a part of the curriculum for the future and will be replicated to the other institutions as well. And last but not the least, the IPAC plans, the integrated people-centered plans, are endorsed by the national and provincial governments and health ministries. Additionally, we have signed MOUs with 3 of the provinces just to ensure that they are committed to these plans and its implementation in coming years. So this is how we believe that the interventions and the changes that we made through this project will remain sustainable.
Really incredible hearing about all the amazing successes of the Pakistan project and the sustainability of it, and looking forward to seeing the impact of it in the future. Thank you very much for your time today, Itfaq. To find out more about Sightsavers Right to Health project, head over to sightsavers.org/programs/right to health. Don't forget to subscribe to the Learning Post so you don't miss any future episodes, and please do go back and listen to our previous episodes. Thank you for listening.